All right, everybody, welcome. Nice to see such a large crowd tonight. And for those at home, I'm being sarcastic. There's very few people here. All right, let's go ahead and start by me calling the meeting to order. Welcome to the study session of October 5th. Let's go ahead and have a roll call. Mayor Bagley is here.
Councilmember Christensen. Councilmember Hidalgo-Fahring. Here. Councilmember Martin. Councilmember Peck. Here. Mayor Pro Tem Rodriguez. Here. And Councilmember Waters. Here. Mayor, you have a quorum.
All right, let's say the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, let's go on to any motions to direct the city manager to add agenda items. Anybody want to say anything? All right, seeing no one, let's go ahead and move on to public invited to be heard. We've got one person, and it was a special request. I've only got a few meetings left, and I'd like to hear from him as much as possible. Strider Benson, ladies and gentlemen, come on up. Like always, you got 3 minutes to say what you want, Strider.
Uh, 951 West 17th Avenue. Several things on my mind currently. Sorry I missed the debate a night or two ago. Too much stress in my life. I can't remember everything. But a couple of things. I'd like to mention the last week when the three congresswomen Cori Bush, Pramila Jayapal, and Barbara Lee testified about their own experiences personally of being raped or being a young teenager and not knowing what was going on, or being severely physically compromised to where her first child was only 1 pound born and almost died, and if she'd had another child, it would have probably have died and killed her. So they gave their real stories, but in the news reports, you didn't get to hear those stories. You only got to hear the conclusive remarks. The Texas Rape and Incest and Vigilante Law is intentionally designed to completely destroy the entire concept of civil law in our society, going back to Runnymede in 1215 in England. There are many other things going on. I would like to quote Greta Thunberg, who spoke at the World Youth Conference in Milan this last weekend, and she said, "What do you think of when you think of climate change?" She said, "I think of jobs. It's not just about, blah, 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 hugging bunnies and hugging trees and stuff like that. The blah, 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 just words. Our hopes and our dreams are drowned in their empty promises, which are words without actions. You look at the context, and it goes back to colonialism and imperialism and the whole hierarchy of our economic society, that some people are not worth as much as others. And so you can wipe them out and it's okay. And don't worry about it, because, the great shining knight on a white horse will come and save the rich. No, the whole planet is in peril. Thank you.
All right, thank you, Strider. All right, Harold, any COVID-19 update?
Yes. Yes, sir. Just need to. So Mayor Council today, it's going to be a quick one, but you can look at the 7-day cumulative case rate per 100,000, and you can see that we're continuing to trend down. The important part of this is, again, we're still in high transmission rate as a county, and but the numbers are down. And when you go to this next slide, you'll see that Boulder County has traditionally had the green arrows going down, but now it's a red arrow going up. I think when you look at this slide here, you can see now that we're starting to bounce a little bit, and that's what it's showing. But generally, the trend is still pretty good. What they really talked about today in the meeting with the administrator meeting is really still some of what we're seeing in other counties. And again, this is a case rate per 100,000 to normalize the data. And if you look at Grand County at 546, and then Larimer at 233, and Weld at 299. And I'm pointing these out for a reason as we kind of get to some of the other data we're starting to see. Again, when you see the trends among age groups, continuing to move in the direction that everybody wants them to move. And I think the general theme was we're moving in the right direction in the briefing we got today. What's interesting in this, and when you look at these slides, and the reason I pointed out what we're seeing in some of the neighboring counties, is probably the biggest shift in the data now is really what we're seeing in terms of the case rate in Longmont compared to the other places within the county, in that it's 44 in the last 2 weeks, 44 and 45%. I kind of mentioned this before, that they're looking at, well, what's the influence on adjoining counties in terms of case rates and what that looks like. I have asked for data for them to break the data down for me by age groups. And the reason why I want to see that is to see, are we seeing this across the board in Longmont, or are we seeing certain age groups drive this number up? When you look at what's happening in hospitalizations, so the ICU availability, if you remember, I think when we first started showing this in the North Central region, it was in the neighborhood of around 20%. Last week we're 13, now it's down to 9. And that's staffed ICU availability, going to the staffing component that we talked about. When you look at the med-surg bed availability, that has decreased as well from 15 to 11%. And then hospitals are still reporting tight staffing. 23% with significant staffing shortages. And they're continuing to take patients from other states. What also came into the conversation too is we're also seeing some of our hospitals in Boulder County also taking patients from some of the surrounding counties that are seeing higher numbers as well. And therefore they're still activated in level 1, and so depending on the facility you go to and their individual capacity, they still are seeing some non-emergency surgeries being postponed. Again, moving to where we need to be in terms of getting closer to the epidemiological capacity, but it's still beyond what Boulder County can handle. And then once again, you're still seeing that there are some deaths occurring. And we had that gap, but we're seeing it come back in. And then when we look at the vaccination rate, percent of the total population is 69.1%. Of the eligible folks eligible for this, 77.9 for the full course, or if you have a partial course, you can see the numbers change. We did get some information that I think it is getting more, they're getting, I guess, to the point where they think the vaccinations for younger adults, especially 5 to 11, they may see that in the next few weeks, the approval coming in the next few weeks. And so everyone's still waiting to see that piece. So that's really the numbers as a whole and what we're talking about. Again, generally as a county, we're moving in the direction that we want to. As a city, we are seeing the majority of the cases in the county occur in Longmont now. And we're just going to try to have them dig into the data to see what that, to see if we can get any kind of clue as to where, within what age group we're seeing the cases grow and see if there's any strategies we can do in terms of communication. Be happy to answer any questions.
I guess my question is, I've traveled all over the state and I've not seen any other masking orders. How many other counties have masking orders?
I think there was one other county that had it.
It's not Denver, right?
No.
Not Weld, not Larimer,
Nope.
not the surrounding counties.
So,
All right, like netting off a portion of the pool. All right, okay. Councilmember Christensen.
At several, at two of the forums recently, I've heard candidates for council and mayor who say that, according to their statistics, and I don't know where they're getting them from, 85% of people in Boulder County have been vaccinated, and 15% of people in Boulder County are disabled and can't be vaccinated, and then that only leaves a few percent. I don't understand these statistics, and I'm hoping you can clarify them, specifically the fact that I don't know why they would say that 15% of people in Boulder County are disabled and can't be vaccinated. Just because you're deaf or blind does not mean you can't be vaccinated. They're conflating the two. Have we really, your statistics do not say that 85%.
so we have 83.5%,
With one dose.
well, that have either received one dose or a full course of the vaccine, and specifically 77.9 of the eligible population.
Right.
So when you look at the eligible population, the percentages are higher.
Yes.
Because you can't vaccinate
Right.
kids under 12.
Yes.
And those that are unable to get it because of medical reasons. And so
Right.
I wouldn't necessarily say that the date, and there was a slide at one point that the county had, and I can try to see if they have it, where they
Yeah.
estimated, I think it was an estimate of those who are unable to get it because of medical reasons.
Okay.
And I wouldn't necessarily say disabled, because you could
Yes.
have a medical issue that prevents you from getting it, but you're not disabled.
I know.
And
That
so-
is, so in your view, those are misleading or false statistics.
I don't know, I haven't seen them, and I don't know what they're
Well,
referring to.
we haven't
so
either, and
it's hard for me to comment on that.
Yeah.
I can say what I've been briefed on, and to say that there is a portion of the community that can't get it because of
Yes.
medical reasons.
We know that.
And I can try to find that information.
Yeah, I don't think it's 15% though. But, okay, thank you, because I keep hearing this and I don't know where this comes from. It's not anything that, you've been presenting this stuff to us for a very long time, and I have not seen any of those statistics that they have cited. So.
I'm not sure.
Yeah, okay, thank you very much.
Dr. Waters?
Thanks, Mayor Bagley. Harold, last week, we talked a little bit about the wastewater testing and as a leading indicator and what it might tell us about what, because we saw the bounce last week. And there were some, there was somebody who was gonna do some reviewing of what the correlates might be and what sense to make of it. Do you have any more insights on that, from the wastewater testing?
I do. I don't know if I can bring it up on this screen. The numbers just got updated an hour or so ago, and let me see if I can pull it up.
Have you had a chance to look at it to know whether or not it's helpful in terms of helping lead us toward
Yeah, so,
what you
so
were
when,
wondering about, like where and what cohorts, or, how do you understand where the infection rate is coming from and moving to?
so what we did is we saw a really high spike in our wastewater, and the highest that we've seen since we've been testing it. And so what we were trying to figure out was that an anomaly? And was there something else in the testing? Because we didn't want to really say, here's the highest spike
Yeah.
that we've seen. The current data trends down, but it trends, the last two data points, and if we can find a way to get teams up other than mine, so you're not getting bombarded with flashing, it trends down. But even then, when I look at the last two data points, they're still probably in that high range. And so what makes sense now to us is when we look at the cases that we're predicting, and what we're seeing in that 45%, there's a connection. Now we just got to figure out to what extent the connection really exists, and that's why I wanted to get some of those other data sets to understand what we're seeing.
So if I were to connect what you just said to slide 8 of the 13, and ICUs having gone from 13% capacity to 9, that's what it looks like? Depending on how you interpret or what the implications are of the spike or the bounce, right? If that's a leading indicator of some, surprise we're gonna get, does what we saw in terms of capacity move from a concern to a crisis with 9% capacity?
Well, I think the piece on this, and I'm going to go to this slide and what we're talking about. So when you look at this point of they've activated the level 1 and the postponement of the surgeries and things like that, we know there's capacity within the system. You just have to shrink that down like we did before, or like they did before. And I think what they're really doing right now, so I wouldn't say that I heard anything about a crisis. What I would say is they're really watching these numbers, and they're managing them daily. In terms of that, but it really is about the transferring from folks from hospital to hospital, because they're really balancing out as a system. And so we have had members of our organization who have had relatives go to the hospital that have probably have gone to the emergency room here, but may have then been moved to Larimer County just because of what's happened and where people are being pushed. And so I haven't heard crisis. I just heard that they're still really watching this based on the numbers. But I also go back to when we were in the height of this, and folks said when they weren't doing any non-emergency procedures, that really created capacity. And so that's how they're managing the system daily, at least what we're being briefed on.
So there are more or less non-COVID cases that are accepted based on how elastic that
Correct.
staffing is. Yeah.
And what we're not seeing COVID overloading the system, but when you take a normal system and then you dump it on top of it, and that's actually a good point to make. One of the things that we still see occasionally is people are afraid to go to hospitals when they don't feel well. And if you remember early on in this, we were saying if you think you're having a heart attack or a stroke or something's wrong, you need to go.
Yeah.
And it's interesting to see how that's even started to transcend into testing for other things. It was all over this weekend on the sports channels about how people being tested for cancer dropped dramatically, and now doctors are identifying later stages because they didn't. And I think that the message is also, you still need to do what you need to do, because that has an impact on the system as well, and how you're trying to manage the system. And I think, thanks for letting me kind of circle back to that, because it is other things that are also driving the overall capacity piece.
I'll be your straight man.
Thanks. All right, let's go ahead and move on. Jim, do you want to come down and we'll do budget? Jim and Associates, Jim and Company, Jim and the Battalion, Jim and the Legion of Doom. Well, it's one of my favorite cartoons, had the Legion of Doom. Yes, okay, the Justice League, how's that?
Good evening, Mayor and City Council. I'm Teresa Malloy, Budget Manager. And so this is our final budget presentation for our 2022 budget. And we have just a few things for you this evening. Wanted to start by letting you all know that we did provide some follow-up information. Two things. The metric data on the FTEs can be found in attachment R. And then in attachment is the the new funding in the general fund that supports equity. And in that spreadsheet, what is highlighted in green is those equity items that are in the third and fourth quartile. And just to let you know that there is $345,410 out of the $432,000 that is in quartile 3. And then in quartile 4, out of the total 66,844 is just a little over 2,200. So on those two attachments, certainly if you have questions on any of the information, we do have staff here this evening that can help answer those questions. So,
Is that a time that you're asking for questions?
sure.
All right, Councilmember Peck?
Thank you, Mayor Bagley. Yeah, I have about 3. It is on 182, which is the Community Health and Diversion. Is this an FTE? It's 182. These aren't in alphabetical orders, I mean in numerical order, so it's kind of hard. Pardon me, it's, I'm assuming it is the code 182. It's under request where it says number dash 2022. And it's called Community Health and Diversion.
So the clinician 2,
Yes,
so that is, so basically what we're doing is taking what previously was funded by grants
okay.
and funding them now in the public safety fund. One of those, one clinician 2.
Okay, thanks for that clarification. The other question I have, and this is actually for a gentleman who emailed the boat at Lake McIntosh. Why are we buying a boat for Lake McIntosh?
So there's a couple of things, and I know David Bell's back there, but if council will remember so we added 2 rangers in a boat, and
Right.
part of it was because the increased volume of folks that we were seeing on there and the need to get out and actually manage the lake based on what we've seen over the last few years. David, I don't know if there's anything that you need to add to that beyond what I just said.
Okay, and the other half of that is, do we have a boat for Union Reservoir?
Yes.
Great. All right. So if that gentleman's listening, there's your answer.
We have a rescue.
The rescue boat.
Yep. So.
Okay, great. And the other one is about the Neighborhood Resource Coordinator, the FTE for that.
Yep.
Now, I know that Wayne Tomac is there now for NGLA. Is this replacing him, or is it?
It's in addition to, and this is a higher level position to help coordinate the broader work that we're doing within the neighborhoods. And this is what so when you look at Wayne's position, there's different funding sources that come in terms of what's part of that. So the sustainability work that we're doing and the neighborhood work. And so the neighborhood coordinating position is really above that, and to help bring everything that we have from a neighborhood perspective to more support to the NGLA, working with neighborhoods that aren't part of the Neighborhood Group Leaders Association, building capacity and sustainability and resiliency within those neighborhoods. And it really is about amping the work that we do and connecting to our neighborhoods, because we're seeing more of a need and more neighborhoods coming to us to do this work.
Perfect. Is Carmen still going to be working
Yes.
in that area too? Okay.
So part of it is on this, part of why you see this in the equity position is because if you remember when I talked about the equity positions, a lot of that work automatically goes into neighborhood services anyway. And so we've asked Carmen to do more of that. So these are also to kind of help fill the gap and then let her be more outward facing and looking more globally at what we need to do and building capacity in over time so we can provide more services to the community.
Good, I think that's a great thing. Then on the property tax rebates, can you explain how that works?
I'll let Jim do that one.
So, Mayor Bagley, members of council, so it's all part of the CARES program. Anyone who
Okay.
qualifies for our CARES program that can get credits on the utility bill is also eligible for the property tax or rent rebate program. And so, again, it's based on income levels. And then if they qualify, we will rebate the city's property tax that they paid on their property tax bill.
Okay, great, thank you.
All right. No more on the queue. Let's keep going.
So then, just to let you know, we also advertised a second public hearing, and we do recommend that you hold that public hearing before you give us your final direction for this evening, in case there is a member of the audience who wishes to speak to you.
All right, let's go ahead. Excellent.
That's the same information you saw last week.
All right, great. I'm not going to read the slide. Everyone can read it. We're going to go ahead and open the public hearing at this time. Is there anyone who would like to come down and address City Council in the second public hearing as far as the budget is concerned for next year? All right, seeing no one, let's go ahead and, oh, I'm sorry. Yeah, come on up. Thank you. I didn't see out of the peripheral of my eye. You've got 3 minutes and share what you'd like.
All right. I am Naomi Curlin, 2073 Goldfinch Court. I serve on the board of Sustainable Resilient Longmont, and I am the chair of their Zero Waste Committee, and I am also the executive director of Longmont Food Rescue. I am commenting tonight specifically on sustainability issues related to zero waste goals in the proposed budget, to the best of my understanding from what I could read in the budget. Many of our city's goals being put forth in our zero waste resolution, which is currently in the process of being updated, are limited in terms of timeline and scope by limited staff time, particularly within the Waste Management Department. If current staff is already stretched thin with the day-to-day management of our service programs, then we need dedicated staff to reach our zero waste goals in a timeframe appropriate to our current climate crisis. Tasks such as researching and drafting a universal recycling ordinance and creating and implementing educational and outreach programs to increase our composting and waste diversion are crucial to reaching our city's sustainability goals, but they are also time-consuming and need prioritized action, which is a challenge when it doesn't seem to immediately impact a department's day-to-day functioning. The 2021 budgeted sustainability positions don't currently include a waste management-specific position, even though it's a vital part of our sustainability plan. Another budget item that would be beneficial to our community is funds to assist community organizations to help make community events zero waste, to help provide compostable and recyclable materials and services. Additionally, the Sustainable Business Program could provide financial support in the form of grants or assisted discounts for newer businesses who are trying to make the transition to sustainable packaging. For new businesses, the cost of moving to sustainable options can be a major hindrance, even though they want to do what's right for the planet. It may not be financially feasible. Funding for the Sustainable Business Program to assist in this transition would make a real difference. Thank you.
Thank you. Anyone else? All right, seeing no one, we're going to go ahead and close the second public hearing on the budget. So thank you very much. Do we have a motion for direction to staff regarding the 2022 budget? You have more?
Yeah.
All right, go ahead.
So what we are going to need from you this evening is your direction on what to do with the second half of the marijuana tax. So the first half does go to affordable housing, so that's $300,000. That has been included in the proposed budget that we did give to you. What is not included in the budget, though, is the second half. Because that is pending decisions from you all, direction from you all, and then we will include it in the ordinances that we'll bring back next week. So another $300,000, plus there is $150,000 in fund balance that was from that second half from 2020 operations. So you have a total of $450,000 that we will need direction on you or from you tonight. These are the options that we have heard previously. There was some direction provided that the remaining 50% needed to go to mental health and addiction. But we are not clear on whether or not that is just a one-year thing, if it is more than 1 year.
So can I just ask, I thought, so how did this get on the agenda? So first of all, I thought we already had determined the 529 jump program. Did we not vote on that and give direction?
Not for this year, Mayor.
So it was a one-time
no, not
funding?
yet.
It was a one-time
So
funding?
We did provide some information to you in last week's council communication.
Right.
On how much we had
Remind me,
funded
please. Yeah.
previously.
Say that again?
On how much we had funded previously.
And it was a one-time thing that we voted on?
There is ongoing and one time. So there is $25,000 in the ongoing budget in '22. And that is ongoing that was added in 2020. So there was 2020 ongoing of 25,000, 2021 ongoing of 25,000, and then 70,000 one time in 2021.
Right.
Mayor Bagley, if I could just also add that the council did tell us that they wanted to fund the JUMP program. We said we were going to be bringing back the marijuana tax, which would be an opportunity, but that you all had to give us still some direction on at least 50% of that tax.
I guess I'm just wondering, are these the only two options, and how did they get on here?
So the first one on the mental health piece was a motion that council made and voted on to
Okay.
bring that on. And then the second one was based on how the 529, I think that was us potentially. on that.
That's fine. I was just curious. I'm not tantruming. I'm just curious how it got on here, because there's other issues. I assume there's a third option, which is other. Right?
Sure.
Okay. I mean, not that I have any ideas, but just to be clear. All right, we've got some people in the queue. Do you want us to discuss this now, I presume? All right. Council member, we got a bunch of people. Let's go ahead. We have not heard from Council member Hidalgo-Fahring tonight, so let's go ahead and hear from her.
Okay, thank you. You know, I actually have some questions. I was not on council when the 529 jump passed, but I was, I'm wondering, what is the data showing that the efficiency or the efficacy of this program? The other thing I'd like to know, and I was kind of asking around, and I couldn't get some answers from kind of folks who are in the weeds with the cultural brokers work, and how is it? Where's the data that supports that it's helping? Our children in poverty, our BIPOC community, helping students with disabilities to actually have a pathway toward higher ed or any kind of vocational or training school, if that is an option, and if they're able to maintain those accounts. So I guess that would go to Karen.
Good evening, Mayor and members of the City Council. Karen Roney with Community Services. And so to answer your question, I don't have an answer. And I would say it because we really are just really ramping up this 529 jump program. So we did have funding first in 2020 for this, and it did take us a while to negotiate a contract with the St. Vrain Education Foundation. So we didn't sign that contract with the St. Vrain Education Foundation until April of 2021. So again, we are just really now ramping that up with marketing and, with the additional $70,000 that council allocated in 2021. That does provide that opportunity for all St. Vrain Valley kindergartners to get that boost, to get that jump. So I don't have, Councilmember Waters sits on that committee for the Education Foundation. And he might have additional thoughts about that, but we do have metrics, we do have a marketing plan, And Christina and Pacheco and her staff are making sure that we are able to connect with all, families in the San Fernando Valley School District and to make sure there's equitable access for these funds and make sure everyone knows it's available. So that is our plan, and I do not have data to share with you about how effective it is, because we are really just getting started, but we will be coming back with, there is a year-end report that we are to be providing with, with that information.
Okay.
So I wish I could give you more.
No, that's,
so-
that's all right. This
that's what it
this
is.
one question about the data actually came to me later, and I was like, oh, we should have prepared you ahead of time. So, that's on
That's
me,
quite
so
fine.
my bad. The other thing, are there other communities or other cities that are doing this type of program, the Jump 529? And
So I'll jump into this, and
Yeah.
this is the classic, it got caught up in COVID kind of equation on all of this. And so I think when we were moving forward, in order to get the school district, they wanted everyone in the St. Vrain Valley to participate in this. And so the direction from council at that point was to provide the additional funding, so that's where the 70,000 I think came from in order to bridge that gap. We were going to then go work with the other communities to get them to participate in this, and then shortly thereafter is when the world, and so for part of the conversation then becomes now, as everything's coming back, is really to engage those other communities to participate in this, and be part of it in a similar fashion that Longmont is, but that's really where we are today. And I think it's also, I know just before, I'm going back in time a little bit, but just before COVID hit, I know we had staff members, I know Carmen and others were involved in one of the original sign-up periods. I think it was at Timberline? Is it Timberline or? Because we needed bilingual staff. There was a need for bilingual staff to come in and try to help with the sign-ups. And so I know we were sending different staff to participate in it, and then the world changed, I think, is
Okay.
where we were.
And I guess I was just wondering if there are other communities in the United States who have these types of programs, and long-term wise, is this, and the reason why I'm kind of piecing this apart is because in my own experience in working with families, they get the kid into college that first year, and they have all this assistance, have all this support, and then, and I've had several families who've come back to me and it was like, oh yeah, I had to pull my kid out, and they had to drop out of school after a year because those sports did not continue. So it's great to have this initial, but having that long term to have them retain and stay, and add to their own investment as well. So that that was one of the things I kind of wanted to look at and know if there's any kind of number or data that kind of backs whether or not the families are. So there is. I see you. So I will talk
I think
to.
Councilmember Waters wants to jump in there and answer that question, but I think.
So there is.
And I think what I would answer, and so I think that, certainly what this city council, this has been part of this city council's work plan and vision for, since 2018, I think, to really focus on multiple investments and strategies to make sure that our youngest residents, birth through 5, have the best chance possible for a healthy start in life and to be on a trajectory for success into as they move into adulthood. So this is one of several strategies that council really has embraced. There is data, as you know, in terms of the return on investment. So if we really help all of our young people, all of our children, to have what they need in terms of health and and early education and a good, healthy, emotional environment, that just really helps to set the stage for success in the future. So I'm sure Councilman Waters, when it's his turn, would like to talk more about that.
Sure,
but,
no, I'd appreciate
so it's several
that.
different investments.
So,
this is
and
one.
I just want to clarify, I'm not looking to disband this. I mean, this is something that's been in process. So, the most destructive thing we can do on council is look at what these back plans are and then come in and just dismantle. I mean, we have to really scrutinize, and what can we do to strengthen the program? So if there are things that are missing, that we make sure that the money is being allocated for additional cultural brokers, rather, instead of just pushing it on the plate of a few to make that outreach, that we are really putting money towards filling in those gaps. And, I just kind of wanted to make sure that the right kind of questions are being asked and filling in any holes, so truly everyone can benefit from this kind of program, regardless of
Absolutely. Yep, absolutely.
race and socioeconomic status. So thank you.
All right, Dr. Waters, I'm going to call on you just because you might have some information that's pertinent to Councilmember Hidalgo-Fahring's questions.
Thank you, Mayor Bagley. Good questions, and I think they're the kind of questions we need to keep asking. So just a bit of additional history on this for the context. Karen was absolutely right. This came out of our retreat on May 20th, 2018. We adopted the goal for our early childhood initiative in September of that year. And in that discussion, wondering what could a city council do to somehow strengthen early childhood initiatives in this community, one of the conclusions was, at the very least, we could do this. We could make an investment in them as kindergartners. Part of the reason is that places like, states like Indiana, the entire state of Indiana makes that investment. A year ago, in the governor's initiative, going into 2021, where I can't remember the bill title, but the conclusion was that every kindergartner, every 5-year-old born after January 1st, 2021, will have a $100 contribution to a 529 savings account starting when they arrive in kindergarten for kids born that year. And the reason is, based on what Indiana's experience and the data that the College Invest program has collected, and this is probably the strongest data point, is that kids regardless of the amount, kids at the point of transition from elementary to middle school, that's when they're asked, with a 529 account, what are your plans after high school? Kids with an account are 7 times more likely to self-identify as high school graduates and as continuing their education in some way. The only difference, right, the only variable in those who do and those who don't was the 529 account. And when you look at the life outcomes of high school graduates, I don't care whether you continue your education or not, in terms of lifespan, all of the associated costs for healthcare, mental health, employment, incarceration, across the board. That's why we know that the investment in education is the best society can make in terms of returns. This particular one, for $50, that turns into whatever, Jim, you could probably do the compounded interest in your head over 12 years, $50, or whatever the average market return is. Somewhere between 100 and 150 probably, 12 years later, I don't know, something like that, if they never put another dollar in. So that money can be used for anything that's education related. If they wanted to go be a ski patrol officer, if they wanted to, one of my granddaughters, when she went to kindergarten and she was asked, what does she want to do for a living? She said, I want to be a tire changer. I don't know where that came from, but if she wanted to get trained as a tire changer, she could use that money to get trained as a tire changer. There's the group that's worked on this. It reflects the school district personnel, the Education Foundation personnel. I've stayed involved with it. We have city staff that's been involved with it. Bonnie Finley, who championed this when she was on the council, has stayed involved with it. The one bit of I don't think it's revisionist history, just additional added to the history, is that in our retreat in February 2020, we had been back and forth in conversations with the foundation on where the school district stood with respect to their enthusiasm for this. And understandably, the school district felt kind of caught with us suggesting a program that only some kids would benefit from, right? Kids who lived within the city limits of Longmont. And the St. Valley School District serves, obviously, a lot more communities. So the school district said at the time, if all the kids could be involved, we'd be way more enthusiastic about getting behind it. So I came to the council in February of 2020, and I carried the minutes of that meeting around with me for months and months, anticipating this question coming up. Then we got to this point of the budget, hadn't come up, so I didn't bring it tonight, or I would read it to you. I came to the council on that day and shared what we had learned from the school district and asked if the council would authorize expanding or growing the $25,000 to $70,000, because that was the estimate of what would be required. That was in 2020. And the notes, if you go back and read the minutes of the meeting, the council said unanimously yes. So in 2020, in addition to the money that Karen mentioned, we authorized that, increasing that to $70,000. A month later, and I committed at the time, and I'd spoken with the mayor about this, that I'd write the letters, I would do whatever needed to do to reach out to other municipalities, to invite them to cover the cost of their children, right? Surely those municipalities would want to make a similar investment, our thought was, and I still believe that will be the case. But it was a little difficult to do the outreach once everything shut down. So we had not quite returned to whatever the new normal is going to be. So that outreach hasn't really occurred. What I've said, again, in this process is that, you know, we get beyond this cycle, and I'll do whatever I need to do that outreach, so that other municipalities would have enjoy the opportunity to support their kindergartners just like we do. If you take that, the 529, this will be my last kind of advocacy on this. Well, maybe not the last, just for this moment. If you take the 529 of kind of the capstone of what we do with our early childhood initiative, in that moment, we didn't have the kind of action plan that has been created through our community coalition that addresses a host of needs to increase capacity, that increases the likelihood that those 550 kids who we couldn't account for during the mayor's summit in the spring of 2019, that we still can't account for. And the effects of the pandemic have been brutal on the whole child care industry. And good on this city, good on Harold and Karen and Christina, listening well to the coalition and other providers around the county who were describing what was happening to them. And this city opened up its warehouse and the access to PPE and cleaning supplies to keep providers in the game who otherwise would have simply shut down. That didn't happen in other municipalities. What didn't happen there is they didn't have access. They did shut down. We salvaged a good part of our industry here that would have, I think, collapsed without that kind of support. So we have a plan now. It's going to require a lot more work, and it's going to require different kinds of funding. But we've invited the coalition and the community to reimagine what does child care and early learning look like, right, in the post-pandemic era. It can't be just a version of what we had before. It is simply inadequate to the needs of not just families, but of the workforce. So if you take the end game there, and this is a capstone, the prospect that we send kids to school as 5-year-olds school ready, and we have kid-ready schools, and you know how many of those gaps that existed day one have melted by then because of the good work we've done. And then to make a statement to 5-year-olds that we have confidence in you, really? That you're going to finish your education after the start we've helped get you off to. The prospects for kids in this community and in this school district are greatly enhanced. And the evidence is true in the places that have taken this approach. And I'll get off the soapbox just with, I guess, one more comment, that we talk about homelessness, economic development, unemployment, mental health, all of the social consequences of a social safety net, or the insufficiencies or inadequacies of our systems to get people prepared to live productive lives. The investment we make that has the greatest potential in reducing homelessness, reducing mental health issues, reducing physical health issues, is to get it right for our kids 0 to 5. This is our best chance. We're on the path to do that. And I think it's the best investment we can make. So at some point in time, I'm going to be happy to make a motion to spend $70,000 on the jump, and the $380,000 is what it's going to be now. Yeah, $380,000, I think, right, of the 450. Yeah, 380 along with 70 gives us the 450. So, Mayor Bagley, when you're ready for that motion, I'm happy to make it.
All right. Councilmember Peck?
Thank you, Mayor Bagley. So coming back to the original question about 529 jump or mental health, I'm the one who actually made the motion that we have this discussion. I talked to Josh Atherton today because I was very concerned that when we make a statement that all children, then our programs, when we start them, should include all children. And this one doesn't. I asked Josh if there was equity in this, and he said no, there was not. There's no way to tell who actually signs up for this, what their ethnic background is. And that did bother him as well. He said he's been concerned about that. So the first initial monies that we put in was the $70,000, as we've said, and $25,000 of that has been drawn down. But of that $25,000, only $3,391 and some change has actually been used for new accounts into 529 jump. That leaves $45,000 left out of that initial 70. So if we, and the reason I think this is important is I think this is an incredible program and that we need to figure out how it's going to be equitable. I like the idea of funding, starting a fund for everybody born that year. That definitely in Longmont would cover every child. So of every nationality, of all diverse lifestyles. Because they still have $29,609 left in that account, because in 2019 they only spent $3,300 of it, I am going to say even if they doubled it this year in a time when it's really hard to get people who've gone through the pandemic to say they can put dollars into something when they're thinking about where am I going to live? Can I pay the rent? Do I have enough food? Can I pay childcare? Because we don't have those programs set up yet. I am saying I am going to make a motion that we, even if they would still have $15,000 left if they used $10,000 of that this year. And I'm assuming that they won't. If we gave them another $70,000 with the $45,000 that is still available to them, I'm not sure they would use all that money this year. So it isn't that I want the program to go away. It's just that in this time slot, will we really use that much money? Can we use it in a better way? And then as we move forward, find out if this is working. And Josh said that he would be glad to come and give a report to council because we don't really know what's going on in that account unless the person who is administering it would come up and give us a report. So what I am saying, the reason that I want to put some of it into mental health is because if you have been paying attention to Longmont, you will see that the homelessness program has escalated. We see people with shopping carts every day, full of stuff. We have a couple of parks that have become somewhat aggressive with transient. And I think that we need to address that issue immediately before it becomes bigger than the police can handle. So I am just going to say that we move to not fund 529 jump this year, knowing that they've already got $45,000 in their account, and that we put the $70,000 this year toward mental health. Maybe it could be used at the suites to work with mental health partners better, whatever the organizations that need help with homelessness or anybody who are on the verge or falling through the cracks. So that is my motion.
Councilmember Christensen.
Thank you. Huh? Oh. What?
Do I have a second?
Oh, yes, but I want to talk about it. Second.
All right, there's a motion on the floor that, so your motion, okay, to get this clear, there's $450,000 available. There's a slide up that says 300,000 for mental health and 150,000 for 529th, but that's not the motion. The motion is to take away $70,000, or the $70,000 and not give it to the program this year. I'm just making, is that the motion? Yeah, sure, go ahead, I just want to be, yeah, I think you're, oops. Do you mind, Councilmember Christensen, if I give the floor back to Councilmember Peck, or?
Sure. that's
Okay.
fine.
Oops, go ahead, I just cleared everybody, I'm sorry, it was a mistake. Thank you. Okay, Councilmember Peck.
So, Jim, are you saying that we have $300,000 that we can allocate to mental health and addiction? That's not the way I read it or heard it.
Mayor Bagley, members of council, so you have $450,000 to allocate from the marijuana tax fund. 300 of it is ongoing, 150 is fund balance. So, I mean, you could do that as you wish, but there's 450 available. And so one of the things that was mentioned previously this year was putting some of it towards mental health and addiction. And we interpreted that to be the other 50%, but I don't think we ever got clarity on that.
Okay, so.
It was the other, my motion earlier was the other 50%
So
of
that-
the mental health.
That would be $300,000.
So-
50% is the ongoing portion.
So you can retract your motion, but the motion was to not fund.
I retract the motion because it, I'm sorry, I misunderstood.
So-
I misunderstood it. So I do retract that motion. I do not want to underfund JUMP, but I do want to fund mental health.
I'm just gonna jump in because we could be, I mean, what I'm hearing is a lot of, I just know this council, and this council has passion for, I mean, we're all behind. It's not, we call it the mayor's early childhood education initiative, but it's not my initiative. It's just named the title of the mayor. But what we all have passion for that. This 529 jump goes into that. We all recognize, I mean, we really started, I remember back when we had those awful instances where, I mean, we began talking about mental health as a result of mental health impacting, crimes of violence in our community. I mean, these are two issues we're passionate about. I'm actually going to, I guess I'm not going to make a motion, but it's very easy, given that we have $450,000 to do both. Continue funding and increase the funding for JUMP, as well as increase the funding for mental health. We're fortunate to have $450,000 that we can use on whatever, but anyway, just my thoughts. So Councilmember Christensen?
Well, can I
I'm sorry, go ahead. Go ahead.
I still need to understand this. So we have $150,000 left. Is that correct? Am I reading this correct? $150,000 fund balance.
Mayor Bagley, members of council, you have a $150,000 fund balance after allocating $300,000 from mental health and addiction. So yes, 150 left over after you've done the 300.
So 529 jump doesn't even come into this motion because it's okay. I understand it now, but I'm sorry, I did not understand what you were talking about. So I take my motion back.
Can I ask a qualifying question?
Yes.
So Jim, there's 50% that goes to mental health. I'm sorry, 50% that goes to affordable housing,
Yes.
and then there's 300,000 left, plus 150,000 that's left over from previous, right?
That's correct.
So tonight you're asking us to one time or whatever, but we've got $450,000 of one-time funds that we can divvy up.
That's correct.
Okay. You still have the floor, Councilmember Peck. Okay, all right. You done? Okay. Councilmember Christensen.
Thank you. I've been waiting for quite some time. I would like to take us back to the distant days when I brought forth legalizing marijuana in this city and was relentlessly attacked by all kinds of people saying it would be the end of us, you know, because they didn't apparently remember when the same thing was said about the anti-liquor people, and they fought at the north end of Main Street for decades. Anyway, so now we have a new revenue stream of about $650,000. When I brought this forth, it was because I heard about Aurora having, legalizing marijuana and using the entire amount for affordable housing. And that's what I had in mind. And as a compromise, I was willing to agree to 50% of it going to affordable housing. Now, what is happening is sort of mission creep, where 50% of it is going to whatever. But we had 150,000 extra left over. So that's where this 150 fund balance comes. To me, that should be split equally between affordable housing and something else. But I certainly have no objection to 529 jump, but I want to talk about that for a minute, because I did do a lot of research when we were talking about this several years ago. So I would prefer to take that money out of the contingency fund, which has plenty of money in, rather than set a precedent of using whatever balance may be left over from the other thing. And I would rather go back to splitting it between 50% of it going to affordable housing, which would mean $375,000, and then $375,000 for, say, mental health, or we could split that in several ways. We could give some to jump, we could give some to mental health. But to me, it's not really fair when we have the extra money left over from the balance last year of $150,000, and now that's all going to go to the remaining 50%. So I'm hoping people have followed that. We were getting $600,000, but we also had a leftover amount of $150,000. So the actual amount that we could be splitting up here is $750,000, correct?
Jim, do you want to say something?
Yes, Mayor Bagley, members of council. So, under
That's
the
why we're
code,
confused.
when this tax was put in place, 50% of every marijuana tax dollar
Right,
generated by this goes to affordable housing.
Right.
It's already gone there.
yeah,
This fund balance is only the other 50%. Affordable housing has gotten their 50% share. So this is left over because, you know, we've been projecting low the last few years.
yeah,
You won't have much fund balance in future years because we are now
oh,
going to be budgeting at 600,000, which I don't think we're gonna see this grow much more.
Yeah.
We didn't have a good handle on it a year ago. We didn't even have them all open when we made that projection.
right,
So you've already done the 50%
okay.
for affordable housing. This is, what do you wanna do with the other 50% that is not earmarked by the vote?
Okay, well, all right, let me speak to, I still think more should go to affordable housing, but anyway. Okay, when we were talking about 529 jump, I did a lot of research because my son, my parents and I saved for my son to go to college, and I did a lot of research on how much people need to save to be able to afford to send their kid to college, and how 529 jump affects that. because we had some savings, my son was not eligible for FAFSA, which would have paid for his college. So as with the experience of Susie, this only paid for this, you know, it isn't enough. This is a very good program for middle-class people. And as Councilman Waters said, it really changes a child's aspirations and his faith in himself. If you go back and look at what Thomas Paine wrote, Thomas Paine wanted to give every kid turning 21, or every person turning 21, a set payment that would buy them a house and give them a stake in life. And that's one thing that encouraged people to go for the American Revolution, was Thomas Paine, who actually understood what people wanted and was actually the one who was the greatest promoter of the American Revolution. I still think that's a very good idea. Weld County has a program where they guarantee, and I don't really, I don't know as much about Weld County as I should, but I have been to meetings with them, I've talked to them about this, I've been to dinners with them. And they fund, out of their county funds, any kid who gets a B+ average gets help going to college. That's funded by them alone. College Invest is a private institution. And so my problem with this is that it's going into 520, into College Invest, who administers this. I don't know what the administration fee is, but we could do this ourselves, just like Weld does, without involving another entity that's going to take a cut in the savings. But my problem with this is it is very good for the middle class. It is financed through tax refunds, but for the lower middle class and the poor, they don't have tax refunds. So it doesn't really work for them, and it doesn't work for them because they would need to be saving an amount far greater than they can to make this work for them. And so this, on the face of it, just does not really benefit people who are lower middle class or poor. It doesn't benefit their children, and then they wind up even more discouraged, as Susie said, because they can only go to college for a year, and then they have to drop out. And it makes them ineligible for other funding like FAFSA and other grants that they could get if they were not funded by that. That was the result of my research. I looked at all kinds of sources everywhere. But as I said, it depends on someone's circumstance. This can be a very, very good fund, a very good help to a lot of kids, and it does give them faith in their future and aspirations for their future, and that's always a good thing. But every parent should make those aspirations and hope clear to their children when they are little, that you're going to go to college, and I expect great things from you. But there are many different ways to finance it. I'm in favor of us funding 529 Jump because we've started it. I don't want to let down the people that have already started it, and I do think it's very beneficial for some people. But I don't think it is the end-all and be-all, and actually it misleads a lot of people, I think, at the low end of the economy. So I would suggest that we fund it, maybe not 150,000, but, you know, some reasonable amount.
Councilmember Waters. Oops.
Turn myself off.
No, that's all right. Councilmember Waters.
Thanks.
Oops, it's all right. Councilmember Waters.
Yeah, there are just some pretty sweeping statements, Councilmember Christensen, that you've made. But if we fact check, the facts are these. There are no fees assessed to anybody to open an account, no cost to open an account. There's a means-tested matching grant program for folks in the lower income strata. If they hit certain benchmarks like $500, they can apply for matching grants to accelerate the rate of savings. So there are some other just factual information that we ought to verify that students with their own family accounts, those accounts do not count against. If grandparents have an account, that's counted against their qualifying for financial aid, but not if they have their own account. I guess the last thing is the College Invest is, in contrast to what's been said, is a subsidiary of the Colorado Department of Education. That's their status. I have to just add one more piece to this. There's been, if I think about process, man, there's been plenty of opportunities. We were asked in May to submit our ideas for budgets. I don't know how many of the things we're talking about now were submitted to Jim, and I'm not going to put you guys on the spot, but I'm guessing none. Now, I did submit a list of priorities. I'd be curious to know if other council members did. I did it a year ago when we had an opportunity. We've gone through multiple hearings to get to tonight to have this conversation. It's pretty interesting since we've had so many opportunities. And it can't be that this just occurred to people today, but I don't know. But most concerning to me is the two comments I've heard tonight using the word equity to suggest that every child is eligible to participate. There is serious outreach to every family in every neighborhood, in every school, elementary school in the St. Vrain Valley School District. We do have cultural brokers and our own staff who are working to translate into Spanish or to any other language for families, first languages, to help with the registration process. But I think what I've heard tonight is that in the name of equity, there's an interest in denying access to the children who would benefit most. There are kids in this community whose families, the $50 donation won't matter. They'll open their accounts, they'll make whatever donations they need, and the kids will be fine. But there's a bunch of kids in this town for whom the $50 would make a huge difference to get it started. And to say that we would want to potentially even think about ending the program because there's not enough of our lower income families participating, to deny them the even opportunity would be the antithesis of an equitable approach. I would think you're not going to means test a $50 donation. That's just not economically feasible. But to say we won't do this because some kids are going to benefit when the kids who need it most are denied the opportunity absolutely takes the idea of equity in my mind and turns it on its head. So I hope that's not what we mean when we talk about equity. That we take away opportunities for the kids who need it most. Because we're not seeing the level of participation, which is largely on us, not on them.
All right, Councilmember Christensen, and then I'm gonna make a comment. Okay, we go Councilmember Christensen, then Councilmember Peck, and then I'm gonna make a comment unless something happens that I'm hoping happens. Go ahead.
Councilman Waters, you certainly know that no one here is suggesting we eliminate this program. And you certainly know that I am on the low end of that. I would never suggest that people be means tested out or that they not get any available opportunity. Everyone is indeed eligible, but we have to actually do the research on whether this is actually helping them or whether it is actually going to serve no purpose for them or little purpose or indeed harm them. And I have read numerous things from numerous sources that question how much use it is for people at the low end of the scale. But still, as I said, I would never want to eliminate this. We've already made a commitment, and we're going to keep our commitment to the people who are in that program and hopefully make it a better program. There are a lot of people on this list of people who are in this, and they're all good people. And so I am not suggesting there's anything shady going on. I'm just suggesting that sometimes what looks like a good program for some people is not always such a wonderful idea for others. But everybody is eligible already. We would never take that away. And to suggest otherwise is really insulting. So.
I'm just curious, do you have any citations, any references? You said research. I'm curious. You said do you have any citations whatsoever? Okay, I'm just curious. I'm just curious. All right, Councilmember Peck.
I move that we fund 529 jump to the 70,000 for another year.
It's been moved and seconded that we fund the 529 jump in the amount of 70,000 for another year. Councilmember Peck, you still have the floor.
I'm going to make another motion when we're done with this one.
Okay, that's fine. And then I'll call on you next. And then, there's nobody in the queue. Is there any dialogue or debate? I'm gonna actually, I look at, so what I'm hearing is, a couple of things. It's, I know that, the whole point of this is to make sure that every child, and I don't want to go back and denigrate certain council members who have said things in contrary to the early childhood education amendment. I do not want, or the early childhood education push or initiative. I don't want to start accusing what I do want to say is the one thing, and this is all thanks to Councilmember Levison. I sat next to Councilmember Levison and we had a mayoral contest, but at the end of the day, she was a champion and got me convinced that the biggest impact you can have on our communities is making sure that all children receive a high quality preschool education, and so early childhood education. I've heard terms, I understand that in general, your odds of socioeconomic disadvantage increases if you're a member of the BIPOC community. But my ex-wife and my children are BIPOC. They don't need help. I also know that there are a lot of affluent people that don't think about these things. I have a child that I'm wondering, I'm hoping he goes to college and graduates. 529s and money isn't the issue. We also don't know, we're going to talk about mental health next. Do we have the data and has the research been done to show that our programs have resulted in change that particularly impact equity in the BIPOC community? The other thing is that, really what it comes down to is I don't care if the kid is white, black, Asian, indigenous, Latino. Every child in our community needs a high quality early childhood education, period, full stop. The data shows that 529s, if a child understands they have one set up, regardless of the amount, is more likely to go to college, therefore graduate high school. Your chance to succeed in life, meaning it's all based on, did you graduate from college? Were you married when you had your first child? And I don't remember the last one was, but it's simple. So I don't understand why we're funding it at 70,000. I think we should just fund the 150. Put the rest into mental health addiction. 50% in affordable housing. I don't understand why we didn't debate this earlier, which I'm not going to start the question of where did this come from. My frustration has been that members of our community, tend to have our ear. It's right here, staff recommended, I think we should do this. So I'm going to vote against the 70,000, just because I think we should do 300,000 for mental health and 150,000 for 529 and go forward. You would amend it? All right, Councilmember Peck would amend it, or accept an amendment that we actually amend it to 150,000 for the 529 jump program and the remaining 300,000 for mental health and addiction. Would your second do that? Is there any other thoughts or comments? All right, so there's no further debate. The motion is we are going to direct staff to fund mental health and addiction for 300,000 and 529 jump for 150,000, one-time funding. And council next year can take this up again. Can't wait. I'll watch. All right, all in favor say aye. Aye. Opposed say nay. All right, the motion carries. Congratulations to all the children who will get 529s and all those who are suffering mental health and addiction who will be helped by this 300,000, as well as those members of our community who require affordable housing assistance. Big win for everybody. So, all right, let's go on. And I want to thank Councilmember Peck for just making a motion.
I want to thank Jim Golden for explaining this to me.
Actually, I mean, we gave him direction. Yeah.
I don't have it. Wait,
And then they'll do it. Jim, is there anything else?
I think there is, but nothing's working.
We need to go back to the slide. One more back.
Don't be making us happy by showing us you only have 6 slides. You guys doing okay? Do we need a 5-minute break? You doing all right? You okay? Okay. Yeah. At 8:30, I'm gonna take a break.
I guess.
Teresa? Do we
I
need,
was just going to say, Mayor, if we could get direction from you all to include that motion that you just made, and then any other, or I guess direction to bring back the proposed budget as we presented it to you.
I'm gonna move that we direct staff to bring back the proposed budget. Do you have, well, so first of all, before I make this motion, is there anything else regarding the capital improvement plan, the pay plan, or the financial policies tonight?
No.
This is it, right?
No, yeah.
I'm gonna move that we direct staff to bring back the 2022 budget, the 2022 to 2026 capital improvement plan, the 2022 pay plan, and the 2022 financial policies as it's been presented to this council, with the amendment that we just discussed pertaining to the 300,000 for mental health and addiction services and 150,000 into our 529s.
Second.
All right, it's been moved by myself, seconded by Dr. Waters. Any other debate? All right, all in favor say aye. Aye. Opposed, say nay. Awesome. We're gonna be able to fund our city the next year. We are way better than the federals. You sure can. Councilmember Peck.
I know this is out of order, but I would like to direct staff to, at the end of this year, no, I'm sorry, at the end of 2022, to find out how many children were born in Longmont and how much that would cost to fund them, to open an account of $50 each. Just for the data. That's just for
Do
the
we know how
data.
many kids were born in Longmont this year?
No,
Not off the top, no.
no, I'm sure
Yeah.
Times Call could probably track
We'd
that
have to
for
go to the
us.
health department and.
All right, can you just get us, so I didn't hear a second, but can somebody look up that data and just tell
Yeah.
us next week, how many kids were born in 20, yep? Council,
I can tell you.
oh, Dr. Waters, okay, I'm sorry.
I mean, I don't have the folder in front of me, but we've gone through all that. We get the information from the school district. I can tell you how many kids were born year after year after year in hospitals in Longmont.
Could you
always have their residence, but with their birth.
Could you get us that data
I will
and
get
send
the
us an
data.
email?
No, absolutely.
I'd like to see the trajectory for like the last 3 to 5
Yeah,
years.
we've been working
plus-
with those data on this, this project and
If you
other aspects of the early childhood initiative.
Okay, let's get that. Go ahead, Councilmember Peck.
So I personally don't think that we need the data for the last 3 or 5 years. I mean, if we're going to discuss funding every child that is a resident of Longmont, we only need last year because,
I just want to see the trajectory so I
Oh,
can then
okay.
determine next year what it might be. So
Okay.
I want to just look at the graph.
okay, thanks.
That's it.
I'll get the most recent 3 years, whatever.
Perfect. And then if he doesn't do it, make that motion again and let's get staff to do it. But I imagine he'll get it. All right, Teresa, anything else? All right, by the way, that would make, if it's just Jim and you are officially the Justice League and or the Legion of Doom. So, thank you, Teresa. All right, let's go on to, I believe, the review of potential amendments to the Land Development Code.
Did you want your break now?
Oh, I
or-
do want my break now. Let's take 5 minutes. Let's start finding our seats again. All right, I just want to point out as we go on that these slides are 10. Jim Golden had 6. So if we were going to grade here based on length of presentation, but you could blow me away. I don't know. We'll just have to see. Pressure's on. Let's see.
Talk fast.
All right, let's go ahead on the review of the potential amendments to the Land Development Code.
Thank you, Mayor and Council. Thanks for this opportunity to show you what's on our plate as far as amendments to Land Development Code. And they ended up there from a lot of different sources, one being the City Council, so you're at the top of the list. And then we also have recommendations from some of our boards and commissions. We know we have a neighborhood association that's very interested in historic preservation, so I'll talk a little bit about compatibility guidelines. And we have some of our policy documents that recommend changes to the Land Development Code. We've got some input from some development community that is interested in some changes, and also staff would also like to make some changes that I think will make Longmont better and make our job a little bit easier. So with that, I'll kick it right off. Oh, I do want to introduce, we do have Don Burchett, our planning manager, and Aren Fosdick, our principal planner, here to back me up when you ask me tough questions, so.
Mr. Burchett, how long has it been since you've appeared before this council? Almost 2 years. So can we go back and review FTEs? And do we really need them, all of them? Just kidding. Love to have you back, buddy.
Okay, this is the list that we put in your staff report, and I think I put as A. I didn't call these priorities because they're all important, but they do follow kind of a logical list. So A was based on our discussion back at the end of August 31st, in a presentation that Kathy Fedler and Heidi Peterson presented. And we're going to dive in a little bit deep. We do have some ideas to show you tonight. B is our rental housing program, and council did explain to staff you'd like to push that out, so I have no intention of going into any detail on that. Amendments to the Historic Preservation Code, of course, HPC and staff have been working on this for some time. And then the compatibility guidelines for our east and west historic neighborhoods. I'll talk about that a little bit. We do have recommendations out of our Main Street corridor plan, and we've had an opportunity to touch base with council a couple of times about that. But we want to move that up on the priorities. And then we're going to talk a little bit about industrial buildings and our design guidelines, or lack thereof, that we have in our code. Some more opportunities for industrial type uses to maybe move into our mixed use districts. And then we have an other category, which is we have a bunch of projects that are moving through the system, and invariably we will end up with additional recommendations to amend the code. So our first was, and I've kind of paraphrased, but we got direction from City Council to create a suite of incentives for affordable and middle tier housing. And Harold,
Yes, I'll jump in. So if council will remember, and we had this conversation, and it was really about a situation where somebody goes and has more affordable housing than they're required. And council, at the end of the day, and you can go ahead and go to this next slide, and then I'll let you. And so what council said, as part of the direction, we gave council a number of options, and you said what you wanted to see is some type of matrix where there was administrative approval component associated with it. And so that's what we put together here now. Obviously, the timing on this, if we can get direction from council, I'm going to want to do this pretty fast, simply because a new council is going to be coming in, and it's better to keep this direction with this council. And so this is a look at an administrative approval process. In talking about this, and once Glenn goes over specifics, there was a certain point where I just didn't feel comfortable with staff making that decision from an administrative perspective. And so that would go to council at that higher end of that threshold. So Glenn, do you want to go over that?
Yeah, so what we have here is, of course, Harold talked about where that line is between administrative approval and council approval, blue versus green. But then in the rows, starting from the top, we've created this number that we're calling adjusted affordable housing percentage. So that not only includes what we define as affordable housing, so that's anything that costs a resident who is making 80% or less of the area median income. What we've done is use the numbers from the inclusionary housing section that gives a little bit of credit for middle tier housing to come up with these adjusted percentages. So you can see 12 is kind of a minimum. You have to do 12% affordable housing. I would say it'd probably be my recommendation, we keep that as a middle, but then we add on to it. So you could go up to, from administrative approval, where you're providing 30 to 35% of adjusted affordable housing. And then that would buy you some additional incentives. The other thing that we added in here is additional considerations. So that would be anything that reduces the use of a car, maybe puts forth some of our sustainability goals, maybe makes the unit a little bit more affordable because we're bringing down utility costs. And we just have a real quick list here, and this is really our first blush. So if there's additions that should be added, let us know. But transit passes, or a car share program at the project, or a deed restriction on cars. And we've actually heard this recently, that you could actually deed restrict one car per unit. That would be a private deed restriction that would be enforced by whoever the association is. Access to transit, I think a typical measure is like 10-minute walk to transit line. If you do better in the very low income, which I think we define as 60% AMI or less, there's definitely additional incentives to the city for that. Harold, you might mention what distributed energy is.
So I think part of what council's also, and this is what we did when we talked about this, was really looking at the broader council goals when you talk about sustainability and other components, and say, so distributed energy is really working and saying if they wanted to put solar panels on the top of the facility to impact sustainability and reduce electricity, but then work with us in terms of the broader distributed energy and how that goes into our portfolio. That would be something that, you know, would have additional weight to it, because that is in alignment with council's goals. And kind of some clarification on this. And so when we say percentage of affordable housing, it's not just an adjusted, because what we've learned in developing on a development project for the housing authority, there's a project that I think is close to 50% in what we're doing, but there's issues that we may need to clarify. And so it gives us the ability to tap into this in things. One of them we talked about was parking and other issues where we've had to deal with that. But what we also realized is you have to have these other components, because if you just come in with a number, and let's say I wanted to come in and on a housing project for the housing authority, and I wanted a 50% reduction in parking. Well, I need to make sure that I'm not going to be having cars all over the place. And so that ties into the deed restrictions and the transit passes and an e-bike share program and all of those things that really fits into this, that it was hard to measure, which is why you see that second column that that Glenn put in to try to say you need other things coming to bear to get this.
So I guess I'm going to jump a little bit, and so again, I respect all the opinion of council, but we're not experts, right? And I I don't want to spend another 4 hours tonight just randomly discussing these possible additional considerations. I'm going to move that the experts on staff present and prepare on some future occasion your recommendations that we will receive and either approve or disapprove. Because I mean, these are all in theory good ideas. We're not experts, we don't know how it fits, and you are just asking for trouble. Just letting you know.
So what I would
So
say
that was a
is,
motion. The motion is that we direct staff to go through these additional considerations as far as the suite of incentives for affordable and middle tier housing and bring them back for council approval based on their expertise. Okay, it's been moved and seconded. Would anyone like to discuss? Okay, Councilmember Christensen.
I just have two additional suggestions. If it is a geothermal development, which is pretty difficult to build, but if there's a large development and it's geothermal, that would be a good suggestion. And also if people, like the Harmony development up in Fort Collins, if they install flash water heaters or mini splits, those would also be fitting in with our conservation plans, and I think those would be good additions to, they're not distributed energy, but they do help save on the utility bills and further our zero waste or zero energy.
Councilmember Peck.
So, thank you, Mayor Bagley. As we are working to electrify our city, I would also like a consideration to be if the development be all electricity, all electrical appliances, et cetera, no gas.
and what we can do, I'm hearing the sustainability theme, we'll just pull those out of the sustainability plan and add those on it.
Okay, there's a motion on the floor. Nobody else is in the queue, and the motion is to direct staff to review the additional considerations along with this suite of incentives for portable and middle tier housing and bring back their recommendation for council approval. Yep, go ahead, Councilmember Peck. Sorry.
So Harold, you had mentioned at the beginning that you want to do this with this council. So when we say bring it back, it has to be,
We're gonna have to move
Very
fast.
fast.
We're gonna have to move fast.
okay.
The concept, I'm hearing council say, yes, this is what you said.
Just,
Bring it
yeah,
back.
you just, yeah,
Okay.
but, yeah, so as soon as you're ready, if you want to do it, just, yep, so all in favor, say aye. Aye. Opposed, say nay. You don't know it, but I just saved you so much
Good deal.
time.
Thank you.
All right,
All right, Historic Preservation Code, the HPC has been working since, I think, March on amending the code. Our last rewrite, as far as I can tell, is 1993, so it certainly deserves it. Basically, what they're doing is taking a good portion of the action items, how you set up a district, how you designate a landmark, that sort of thing, and moving it into the Land Development Code and keeping the purpose and the duties of the Historic Preservation Commission in Chapter 2. There are some changes to the powers and duties of Historic Preservation Commission. We are gonna further discuss that with the HPC, but we do wanna come back to council and get your blessing on that before we move forward. So that's basically what this is about. And then, we do have in the budget, additional money to put together compatibility design guidelines for both of our residential historic districts. This is actually something that the folks from Henna dropped off, I think, when we had our public forum. Actually, some good thoughts there. And it's only 2 pages. I really appreciate that. So we are already have a good start on this project.
so can I ask a quick question? So on that, I'm sorry, I don't want to cut you off. Do you have a question for him, Councilmember Christensen?
Yeah, I'm wondering if, actually, okay, this is sort of a point of order. You skipped from point A with inclusionary housing to point C, amendments to historic preservation, and left out the rental licensing. Are we going to go back to that?
No,
I wasn't gonna talk about it.
we'd made the motion to put it off till the first quarter of next year. you guys made that motion and,
Yes, but, okay. Okay, but it says here until the latter part of the first quarter, and I thought we agreed to have it be the first part of the first quarter.
no.
Okay.
All right,
All
so
right.
let's go, so I guess, Mike, so my question is, as far as the Historic Preservation Code goes, you're just needing a motion, it sounds like, in direction to bring back design guide standards? Is that
Yeah.
what the words you used?
We're gonna bring them together.
So do you need a motion for that? Are you asking
I
for
don't
one?
think so.
Or are you just telling us?
I'm just telling you, and if you say
Perfect.
stop doing it, then we'll stop doing it.
Anybody want to
That's fine.
stop doing it? The answer is no, right? Okay, no one wants to stop doing it.
Excellent.
Yeah, okay, let's go with, the people in the queue. Let's go with, Dr. Waters, then Councilmember Christensen again.
So I have no objections to what you just, that exchange that just occurred. Here's my concern. You know better than anybody up here, what's the sequence of these land code or standards, changing in standards, that will accelerate or expedite the kind of resolution or clarifying to the degree that there is confusion in conflicts between codes or between standards and code, or the ordinance and code or standards, all of the above. So I've seen, everybody's seen the timeframes here. We just had the comment about skipping past for tonight's discussion. For my money, what I'd like to see this group bring back is for them to decide what's the sequence of code changes, Mayor Bagley, that needs to occur to resolve what we know to be the highest priority, most urgent issues in planning, and then in the review cycle, and where things get hung up, whatever that sequence is. And I'm guessing that rental licensing is nowhere in that sequence. So from my perspective, it ought to fall appropriately to the bottom of this list until we get the rest of it cleared out. How it becomes a priority over these other things is a mystery to me. But it seems to me that what we ought to give clear direction to the staff is bring us those things that are most critical for moving the projects through the process that need to move to be compatible with the codes. And then if we're going to deal with rental licensing, let's deal with that at the appropriate time, because I don't know how it rates as a priority against the rest of these, because all of these are priorities.
So Mike, I guess, so before we get into it, and I'm trying just to, I know the council well enough to know what they want to say and do. My question is, will all this be done by the end of the first quarter prior to that rental licensing discussion?
No.
Okay, then we'll just have to see what happens, right? All right, Councilmember Christensen.
Okay, I'd like to return to what we were talking about, which is historical preservation code and compatibility guidelines. I would just like, I thought that Ms. O'Leary from the east side gave a very good request, which is to put a moratorium on more building and things for more building and renovations and stuff, because what's happening both on the west side and the east side is all kinds of things are going on. They're all administratively approved, there's no notice, and things are being taken down to the studs, and yeah, so we need to have a moratorium on stuff until the Historic Preservation Code and the compatibility guidelines are codified, so that this council can vote on it, and then we can resume work on the east side and west side where it's appropriate. I would move that we have a moratorium on issuing permits for renovation and expansion of buildings in the historic east side and the historic west side until such time as the Historic Preservation Code and the compatibility guidelines are codified, and that shouldn't be very long, allegedly, right? So, do I have a second?
Okay, the motion fails for lack of second. I know where you're going with that, but I hope we just hurry, because I kind of predicted that would include the ADU unit had that passed, correct? The ADUs and whatnot?
Yes, probably, because what they're doing
So-
is building enormous buildings.
Right, so I mean, so yeah,
And
let's,
we don't want to really slow them down, we just want them to be done.
right, so,
In a
so,
different way.
so my question is, what do you need on the historic preservation code? You're just informing us, you don't need a
Yeah,
motion.
just continue along this path.
In compatibility guidelines, anything else on that? Just continue
Nope.
along this path? All right, no,
Nope,
no one
we're intending to
objected.
do it.
Nobody objected when I asked, so keep going.
Okay, again, this is something we presented to you before. It's the recommendations out of the Main Street Corridor Plan with the idea of intensifying development around some transit hubs and catalyst sites. And there's a depiction of it here, but basically it'd be amending the code to restrict some auto-oriented uses, increase heights, reduce setbacks to the street. FAR is floor area ratio. It's just another way of measuring intensity of development. Incorporate some low-impact development guidelines, and also define what the appropriate landscaping is. I think the idea is to move North Main Street into more of an urban corridor where you may have trees and grates versus a tree lawn with a tree in there. So that's what that is. Parking was also a part of that, and I just want to give a shout out to our transportation group. Phil and Ben Ortiz are working on the parking for the corridors, areas that are served by transit, but that could increase. So that's what this is. We expect, some work has been done, so we expect to have something before you first, second quarter of next year. That is quick enough. That's, I'm ready to move on.
Nobody likes to show off. Nobody likes to show off. Okay, what else do you need?
That's it, Mayor.
All right, great. We have a few questions or comments. We're gonna have a guest speaker here, Councilmember Hidalgo-Fahring. Welcome to the dais again tonight.
I am paying attention.
No, that's not me. I was just saying
No,
that
I know, I'm
everybody's talking, but you guys,
Yeah.
the only problem, we're still waiting for Mayor Pro Tem to come in with
I'm just absorbing it
a
all.
ray of
but,
knowledge.
just taking it all in. So, I do want to comment because I've had conversations with you about North Main and just kind of throwing a little love at there and adding a sense of urgency in getting work done. So I'm really excited to, I live northwest side of Main Street, and I'm really excited to see, the plans, coming to fruition and seeing that you're pushing this along. So I greatly appreciate the efforts and work that's being done. And yeah, definitely a shout out to Phil because I've talked to him as well about work that they've done. So thank you. Yeah.
Okay, thank you.
So, and I'm sure the residents in the area will be happy as well. So it's long overdue. Thanks.
Moving on.
Moving on.
Okay, one of the inputs we've got, I quoted some numbers out of the market study that was done recently for LEDP and I think the downtown authority as well. But we're seeing a lot of these multi-tenant industrial buildings, and it is one of our more active segments of our development world. So we are often faced with how do you review the architecture of an industrial type warehouse building according to, we only have two standards. We have a residential standard to measure it against, or a non-residential, commercial, or mixed-use standard. And as you can see, those, I put a graphic here on the left of, we're trying to apply those standards to industrial buildings. We think we have a good idea of either creating separate design standards that are appropriate for industrial building based on where they are. If they're adjacent to a active commercial district, maybe those standards are a little bit higher. If they're out on an arterial street, maybe those standards architecturally are a little higher. But for the most part, these are buried in an industrial park, and they're really, the form follows the function. They're a distribution or industrial building, and they should look like that, and they should act like that. So that's something that staff's bringing forward. We think it's a fairly easy fix. We'd like to, jump on that in the second quarter of 2022 of next year. Do you have any questions about what that entails?
Oh, Councilmember Christensen.
I think that's just, well, I really do. And I think it's a good plan. They don't need to be as restrictive as they are sometimes, because if they're in the middle of an industrial area. However, what I wanted to do was comment on E, which is development standards. And I just want to comment on the picture that you showed. I love that picture. It's got all kinds of trees.
Yeah.
Looks very jolly. Looks like the love continues all the way up and down Main Street. That's what we want. The one thing I would change is the second bullet, which says reduce front yards. I think you mean setback, right? I don't think there are any front yards on Main Street, correct?
Well, I guess we would say front yard would be what fronts Main Street.
What?
What's actually adjacent to Main Street would be
Okay.
a front yard.
Most of us, when we say front yard, mean an actual front yard.
Grassy
I
area.
would just call that setback, because
Okay,
it's
you're right.
from the building to the street.
Let's call it the grassy knoll.
Grassy knoll, yeah, the
I stated
ungrassy
it
knoll,
correctly.
because the
A
whole
flat
point is
knoll,
most of
but-
it doesn't have grass, so. Yeah, that's a good idea, because it doesn't need to be nearly as much as it is in many cases,
Yeah.
and that gives the business more room to expand. So,
Right.
Thank you for this.
Yeah, I love this picture because it reminds me of Abbey Road,
Yeah.
which I think is about 50 years old. Okay, along the same lines, we've also been approached with perhaps an opportunity to put a small light industrial, multi-tenant type of building within a mixed-use district. At first, we thought, well, I mean, that's our revenue generators, but we do have plenty of areas in Longmont where there are not so great retail sites that are off the main arterials and pretty invisible, where there might be an opportunity to build a structure that looks very much like a retail structure, but perhaps has some lighter industrial uses in it. As you can see, I mean, on the top picture on the right is a typical retail center, and on the bottom would be more of again, a small multi-tenant flex space. We also think there'd be opportunities to maybe reinvigorate some shopping centers that are running on tough times right now, and maybe have a higher percentage of vacancy. It might be an opportunity to get new uses in there. And then we also have kicked off the steam sugar mill area. And you may remember that the TAP report talked about the potential for an agri-hub in the sugar mill area. So this would be a use that I think would fit within that mixed-use industrial, residential, commercial kind of area. So it was brought up by a developer, but I think staff sees that this perhaps would have some benefits.
Councilmember Peck.
Thank you. Glenn, in the design standards, and this is just my opinion, when we're talking about both ends of 287 Main Street, when you're doing this light industrial, is there any way in the design standards not to have all the parking and asphalt in the front of this building? To have more of a presence, to have the building closer to the street rather than all the parking and maybe in the back with, could we incentivize that in some way? It's just an opinion.
That's really a key design element,
Okay.
because you want to move those buildings up close to the street. It also slows traffic, so that's a
Correct.
benefit as well. But it gets a lot of visibility to buildings as well. So, yeah, we have large expanses of unused parking lots.
Yes,
at
we
least on
do.
the north part, that could be much better utilized.
Okay, thank you.
You bet.
Councilmember Christensen.
Glenn, piggybacking on that parking, a lot of what makes the difference between the way north and south Main Street versus downtown is that parking that is, huge amount of parking. And the other problem is people are kind of going in and out and in and out, and there are it creates problems with traffic and accidents and things. And so, yeah, I applaud that. And I also think this is a terrific idea, because as it says in here, a lot of small businesses just need a small thing. What they need is something they can afford.
Yeah.
And it doesn't, and it just can be very basic, you know. And there's good example of this is a place just north of where the pantry used to be in that shopping center on Francis, where the pub is, the Francis Street Shopping Center that's just north of the high school. There's a tiny little grocery store there, and I can't believe he's still there, but he's still there.
Yeah.
And it serves a purpose, and it's, God love him, he's making a living there. And so that's what he can afford right now, and he's doing okay, and he's serving a huge purpose in that neighborhood for people who don't have cars or can't get any, you know, they just want something quick. And so this is really exactly what they say, places where entrepreneurs can get a start that's affordable and adds a lot of economic diversity and diverse businesses to our community of all kinds of things that we never would have thought of otherwise. So I really think this is a terrific plan. Thank you.
Yeah.
I do, however, think that most of this community has no idea what's going on with steam and sugar mill.
Okay.
I think we need to have some public forums on that so they do know, so they don't get outraged.
Right, yeah, and where we are, to give you a little bit of background, is the consultant is going to come to us with a public participation plan. And if you remember, when we first presented, I think Tony and I presented some of the ideas back last spring. It would be great to get some council participation in the process. So our intent is to come back to council, show you what the plan is, and hopefully get some volunteers from this group.
Well, but also to actually have public forums where people can talk, where they
Right.
can have these things presented to them, and they can ask questions and get answers. Because right now, things get presented to them, and they never get a say in it, or they get 3 minutes. And I think it is going to change this community to a great degree, and people need to know about it, and maybe even vote on it, whether they really want to do this. So, anyway.
I just want to say, I think it's inappropriate. You need to redo I don't think all stores should have the word signage on it. I'm kidding, that was sarcasm behind the mask.
There's a high demand for signage.
You know, because I think that as cool as it looks, I just think people will get confused. All right.
Got it, Mayor, thank you.
No problem, thank you. Let's go on to slide 9.
Again, this is kind of our catch-all group. As I mentioned, steam sugar mill, we're gonna move through that plan, and it seems to be the process that our code isn't exactly right for the kind of development and the vision for that area. So I would suspect we'd probably see some other amendments come through. Staff has been utilizing the Habitat and Species Protection plan. We think that we can clarify some things in there in the area of defining where a riparian area is, defining the trees that are worth preservation, preserving. And then also, there's some changes we'd like to make to the prairie dog process as well to make it a little bit more efficient and good for everyone involved. And then one thing I failed to mention is also on our to-do list is revising Envision Longmont and incorporating your sustainability goals into the plan. Again, there could be some code changes that come out of that. But with that, Mayor, here I was just going to finalize with the list. Do you want to move anything up or down, or I think we've pretty much covered everything.
I move that we accept the presentation as is. All right, it's been moved and seconded. Seeing nobody else in the queue, the motion is to accept the presentation as is. All in favor, say aye. Aye. Opposed, say nay. All right, thank you for your work.
Great, thank you.
All right, let's move on to Mayor and Council comments. Anybody? All right, great. Every once in a while, Mayor Pro Tem, would you like to say anything to finish us off tonight? No? All right. You could sing us a song. Yeah, there you go.
This is the end.
Yeah, yes. All right. I'm going to go ahead then and go on to city manager remarks. Nothing? All right. And then council member Eugene, anything?
No comments, Mayor, other than we're adjourning to executive session after this.
All right. I will not be able to attend, but I've already, we can't vote in there anyway. We just kind of talk, and I've made my opinions and thoughts known to the city manager. And I've asked Mayor Pro Tem Rodriguez, who is very adept at running meetings and doing his job, to do that for me this evening. So thank you. So can I have a motion to adjourn? I will second. There's a motion to adjourn on the table. All in favor, say aye. Aye. Opposed, say nay. Passes unanimously. We're adjourned. Log out.